Friends, welcome to my workplace at Ranaghat, West Bengal, India. In this video, I am going to demonstrate implantation of PanOptix intraocular lens. PanOptix is a trifocal intraocular lens from Alcon. It is made on Acrisoft IQ platform. Let us observe this surgery. The patient has opted for trifocal intraocular lens. By this time the main incision has been made. Now visco has been injected into the anterior chamber and it has been applied over the ocular surface. And now side ports. This is a side port on the left side of the main incision, and this is another side port on the right side of the main incision. The side ports are about 3 clock hours away from the main incision. Now capsulorhexis is being done. I use a Utrata forceps for capsulorhexis. While doing capsulorhexis, we must lift up the anterior lip of the main wound so that leakage of visco becomes minimal through the main wound. Hydrodissection is done, hydrodelineation is also done. In this case, hydrodelineation has produced a beautiful golden ring. The nucleus is rotated. You can see this is a soft cataract, and those patients who opt for multifocal intraocular lenses, most of them have soft cataracts. And now let us see the nucleus management. The tip of the phaco needle goes into the anterior chamber, and now I'm going to divide the nucleus into few pieces, and the nuclear fragment is emulsified and removed. The machine being used is Farouz from Otley, Switzerland. Now epinucleus. Epinucleus is removed. Ultrasonic energy used in this case is 40%. Flow rate is 45 ml per minute. Vacuum is 450 millimeter of mercury. Now visco is injected into the anterior chamber, and then this is aspiration of cortex. I'm using a Simcoe cannula for aspiration of cortex through the main wound, but since the side ports are small in this case, I will not go through the side ports with this Simcoe cannula. So I am going to take bimanual irrigation aspiration probes for removal of the subincisional cortical lens matter. Irrigation is from the right side port, aspirating probe from the left, and the subincisional cortex is removed. Small bit of epinucleus, it is irrigated. Little bit of polishing of the posterior capsule by the fluid jet. we may call this hydro polish. And now let us get the lens. This is a totally unedited surgery. Anterior chamber and capsular bag is filled up with SPMC. And now this is the lens. PanOptix Trifocal Intraocular lens. And now this is the lens is irrigated with BSS, and this is a C cartridge from Alcon. The lens is placed inside the cartridge in such a way that both the haptics are on the anterior surface of the lens. And now the lens is injected into the anterior chamber. This is going to be wound assisted delivery, because this cartridge doesn't go into the eye. And here it is. The lens has gone into the capsular bag. The lens can be placed in any way, because this is not toric lens, this is multifocal intraocular lens. The haptics can be placed anywhere. And now the visco from the anterior chamber as well as from the capsular bag is irrigated. First I'm using the Simcoe. We must spend some quality time for removal of visco. There should not be any rise of intraocular pressure because of viscoelastic substance. And now this is irrigation and aspiration. We must take care of the optical part of the lens. We must not touch frequently the optical part, the central part of the optics. Patients are happy with this lens because the patients get near vision, intermediate vision for working on laptop, and distance vision. So implantation of multifocal intraocular lens is just like a routine cataract. Only thing is we must do a rhexis which is about 5 mm in size, 5 or 5.25 mm in size, so that the capsular rim overlaps the optical part of the intraocular lens all around. This ensures that the lens will not be tilted and right kind of refraction will happen if the lens is centered beautifully. And we can see this in this case the rexis is of right size. It has overlapped the optics of the intraocular lens all around very nicely. This is the final lavage chamber. And the antechamber is nicely formed. The integrity of the wounds are checked. There should not be any leakage from any side. Few drops of moxie is applied and the case is concluded. Thank you very much for your attention. Hope this video will help you in developing your surgical skills. Be a great surgeon and serve your patients with love, respect, empathy, and great surgical competence.